Are you struggling with your child's bedwetting? Wondering if it's just a phase or if it's time to start nighttime potty training? You're not alone. Should you be worried? When is it time to intervene? Understanding the difference between typical bedwetting and the need for nighttime potty training is crucial. In today's video, we'll break down the key differences between bedwetting and nighttime potty training, so you can better support your child. Let's start by understanding bedwetting a little better. It's a topic that many parents find challenging, but it's important to approach it with empathy and knowledge. Bedwetting, or nocturnal enuresis, is when a child accidentally pees during sleep. This can be distressing for both the child and the parents. It's incredibly common, especially in kids under 7. In fact, many children experience this phase as part of their development. Think of it like this. Their little bodies are still learning to control those muscles while they sleep. It's a natural part of growing up. It's like trying to juggle while riding a unicycle. It takes time and practice. Just as they learn other skills, they will learn this too. Now, one of the most important things to remember is that bedwetting is not their fault. It's a developmental stage, not a behavioral issue. It's not a sign of laziness or defiance. Children need to know that they are not to blame. Imagine waking up in a puddle, feeling confused and ashamed. It's a tough experience for a child. Instead of scolding, we need to offer comfort and reassurance. Let them know they are loved and supported. Let them know it's okay, it happens to lots of kids and we're in this together. This can help reduce their anxiety. In most cases, bedwetting simply fades away as children grow. Their bodies mature and they gain better control. Their bladder control matures, they become deeper sleepers, and voila! Dry nights become the norm. It's a gradual process. Deep sleep patterns can make it difficult for a child to wake up when their bladder is full. This is a common reason for bedwetting. Genetics plays a role too. Did you or your partner experience bedwetting as a child? If so, it might be passed down. If so, there's a higher chance your little one might too. Understanding this can help in managing expectations. Stress and anxiety can also contribute. It's important to address any underlying emotional issues. It's essential to create a safe, loving, and supportive environment for your child. This will help them feel secure and reduce stress. Okay, so we've tackled bedwetting, but what about nighttime potty training? When is the right time to introduce that? It's about actively teaching your child to wake up when they need to go pee, just like they've learned to do during the day. Timing is crucial. We don't want to start too early before their bodies are ready. So how do you know if your child is ready for nighttime potty training? Well, there are a few telltale signs to look out for. The first clue is daytime dryness. Is your child staying dry during naps? That's a great indicator that their bladder control is maturing. Second, are they waking up dry multiple mornings in a row? This shows that their body is starting to hold on to pee for longer periods, even during sleep. Lastly, can your child go to the potty independently during the day without any help? If they've aced daytime potty training, they're off to a great start. Remember, patience and positive reinforcement are your best allies during this important journey. Chapter 3. Tips and Tricks for Smoother Nights. Alright, so let's say your child is showing all the signs of readiness, and you're both geared up to conquer nighttime dryness. This is a big step, and it's important to approach it with a positive mindset. What are some practical tips to make this transition smoother? Well, I've got you covered. These tips are designed to help both you and your child feel more confident and prepared. One simple yet effective strategy is limiting liquids before bedtime. This doesn't mean cutting off fluids entirely, but rather being mindful of how much your child drinks in the evening. Instead, try shifting their fluid intake to earlier in the day. Encourage them to drink more during breakfast, lunch, and early afternoon. Encourage them to drink plenty of fluids throughout the day so they're well hydrated, but taper it off as bedtime approaches. This way, they won't feel too thirsty at night. Next, establishing a consistent bedtime potty routine can work wonders. Consistency is key in helping your child develop good habits. Just like we have a sequence for brushing teeth and putting on pajamas, adding a potty stop to this routine can be incredibly helpful. Make it a fun and positive part of their nightly ritual. Have your child use the toilet right before hopping into bed. This helps ensure their bladder is as empty as possible before they fall asleep. This helps empty their bladder and reduces the chances of accidents during the night. It's a simple step that can make a big difference. Now let's talk about those inevitable accidents. They are a normal part of the learning process, so it's important to handle them with patience and understanding. Accidents happen, and that's okay. It's all part of the learning process. Reassure your child that it's nothing to be ashamed of and that they're doing a great job. But to safeguard against those middle-of-the-night mishaps and protect your mattress, waterproof mattress covers are your new best friend. They make cleanup much easier and less stressful. Another technique that some parents find helpful is the gentle wake-up method. This involves waking your child up for a quick bathroom trip before their usual wetting time. It can help them get used to waking up when they need to go. Instead, gently wake them up an hour or two before you think they usually wet the bed and guide them to the bathroom. Remember, consistency is key. Over time, this can help them develop the habit of waking up to use the bathroom. Stick to your routine, be patient, and offer tons of encouragement along the way. Celebrate their successes, no matter how small, and remind them that they're making progress every day. Chapter 4. When to seek expert advice. We've talked about bedwetting being common, especially in younger children. It's a phase many kids go through as they grow and develop. But what if your child is a bit older and still struggling with nighttime accidents? This can be concerning for both the child and the parents. When is it time to seek professional guidance? Knowing when to reach out for help can make a big difference. If your child is over 7 and still experiencing frequent bedwetting, it might be more than just a developmental phase. Or if they suddenly start wetting the bed after being dry for several months, this could indicate an underlying issue. In such cases, it's a good idea to consult with your pediatrician. They can provide valuable insights and guidance. There might be underlying factors contributing to the bedwetting that need to be addressed. These could range from medical to psychological. While most cases are simply a part of normal development, it's important to rule out other possibilities. Sometimes medical conditions or stress can play a role. Identifying these factors early can help in managing the situation better. Your pediatrician is your trusted partner in this journey. They are there to support both you and your child. They can rule out any medical conditions such as urinary tract infections, which might be causing the bedwetting. Conditions like diabetes or sleep apnea can also contribute to bedwetting, and your pediatrician can help diagnose these. By reviewing test results and conducting thorough examinations, they can pinpoint the exact cause. Sometimes bedwetting can be a sign of emotional stress or anxiety. It's important to consider the emotional well-being of your child. Life changes, like starting school, can be significant stressors for children. Moving to a new house or family issues can also contribute to stress. These stressors can manifest in various ways, including bedwetting. Bedwetting can be one way children express their stress or anxiety. In such cases, your pediatrician might recommend a visit to a child psychologist or therapist. Professional help can be very beneficial. Seeking help is about being proactive and ensuring your child receives the support they need to thrive. It's a step towards a healthier and happier future for your child. You've got this, super parents. Remember, patience and encouragement go a long way. Bedwetting is a phase for most kids, and nighttime potty training will come when they're ready. If you found this video helpful, give a thumbs up and subscribe for more parenting tips. And don't forget to share it with other parents who might be going through the same thing. Comment below, what's your biggest potty training challenge? Let's support each other.